today on Facebook Live, I am talking about the acute pancreatitis. So, what is an acute pancreatitis? First, we see what is pancreas. Pancreas गुजराती में उसको स्वादुपिंड बोलते हैं. वो एक एंडोक्राइन और वो ऑर्गन है, वो स्टमक के पीछे रहता है. उसका मेन फंक्शन क्या होता है? ही प्रोड्यूस द इंसुलिन दैट कंट्रोल द शुगर and prevents the diabetic. And second function of the pancreas is to secrete the enzymes, amylase and lipase. These are digestive enzymes. This will come into the intestine and it digests the amino acid and protein and fat. So two important function of the pancreas is there. So this is a function of the pancreas where it is situated behind the stomach in the पेट में बीच में. तो एक्यूट पेनक्रियाटाइटिस क्या है? तो एक्यूट पेनक्रियाटाइटिस इज एन इन्फ्लेमेशन ऑफ द पेनक्रियास. उसको हिंदी में पेनक्रियाट की सूजन बोलते हैं. पेनक्रियाट की सूजन होती है और ये एक कॉम्प्लिकेटेड डिजीज है. आई वुड से द डेंजरस और ग्रेव डिजीज है. और ये पेनक्रियाटाइटिस क्यों होता है? व्हाट इज एन इटियोलॉजी बिहाइंड द पेनक्रियाटाइटिस? तो कॉमन इटियोलॉजी ऑफ द पेनक्रियाटाइटिस इज ए गॉलस्टोन. गॉलस्टोन मीन्स पित्त की पथरियाँ. जिनको पित्त की थैली में पथरियाँ हैं तो वो पथरियाँ पित्त की थैली में से स्लिप एंड केम्स टू द कॉमन बाइल डक्ट. बाइल डक्ट एंड पेनक्रियाटिक डक्ट both opening into the same channel into the intestine. So if stone comes into the bile duct, it will block the pancreatic duct and produce pancreatitis. So here in our area we see the 40 to 50% patients of pancreatitis due to the gallstone. So किसी को gallstone है तो इसको lightly, don't take it lightly. It may produce a severe complication like a pancreatitis. Second common causes है तो alcohol. So it is a dry state, but officially or unofficially people are consuming alcohol, and this alcohol produces pancreatitis, and again it is a severe disease. Third common cause is not a common cause, but rarely less common cause, 1 in 2000 is a trauma, accident, कोई injury हो सकती है pancreas को, hyperlipidemia, hypercalcemia. These are the common. Few drugs also that used for some disease that also produce pancreatitis. And now the rising cause is one is an iatrogenic, means during the surgery if it damage the pancreas तो pancreatitis होता है. और ERCP is an endoscopic procedure to remove the bile stone from the bile duct. During the ERCP procedure, 2 to 5% patient will develop pancreatitis. So this is the common causes, and 15 to 20% patient we couldn't find any reason for pancreatitis. We call it an idiopathic pancreatitis. So how this pancreatitis presents? How the person can know that he has a pancreatitis? The hallmark of the pancreatitis symptoms is severe pain, severe epigastric pain means एब्डोमेन के ऊपर के पार्ट में सिवियर पेन. तो मॉर्निंग में हुआ, स्लोली इट इज इंक्रीजिंग मीन क्रेसेंडो, धीरे धीरे वो बढ़ता जाएगा. नॉट रिलीव, ओकेजनली इट मे एसोसिएट विद द वॉमिटिंग एंड इट मे रेडिएट टू द बैक. तो मॉर्निंग में माइल्ड पेन है, दोपहर को ज़्यादा हो गया, शाम को इंजेक्शन लेना पड़ेगा, रेडिएटिंग टू द बैक, एसोसिएटेड पेन. दिस इज अ वेरी क्लासिकल प्रेजेंटेशन ऑफ पैंक्रेatitis. If anybody having a pain in upper abdomen, severe pain, we always suspect the pancreatitis. It is associated, this is an early presentation. Then slowly there will be ascites, abdominal distension, and so many presentation is there. But if anybody having this type of pain, he should rush to the ER emergency room and get investigated. So this is the common presentation of pancreatitis. And how we will diagnose the pancreatitis? What we'll do in the hospital, कि भाई acute epigastric pain, is it pancreatitis, or other common causes of this type of pain is peptic ulcer, acidity, perforation, cardiac pain also present occasionally in epigastrium. So differentiation by two investigation. One is biochemistry. So blood test we have to check the amylase and lipase. This is enzyme secreted by the pancreas. If they are raised in the blood, more than 3 times than the normal value, then it is a diagnosis of pancreatitis. So usually after 1 or 2 hours of the pain, it will raise and will remain elevated up to 3 to 4 days. Second criteria is imaging. If you do a sonography or CT scan and if it shows the pancreas is inflamed, edematous, then this is a diagnosis of pancreatitis. So the three part, one is a epigastric pain, severe, biochemistry and imaging. If 2 is positive, then it is a diagnosis of pancreatitis. Routinely we don't do a CT scan to diagnose the pancreatitis because the blood biochemistry and sonography will diagnose the pancreatitis. But if they are showing a equivocal results, not confirming the diagnosis, and we have to rule out the other causes like perforation and other, then and in early part we do a pancreatitis, we do a CT scan, it will give the confirmatory diagnosis of pancreatitis. Now this is a cause, this is a presentation of the pancreatitis and diagnosis of pancreatitis. Now what is the severity of the pancreatitis? That is, this is a disease where we do a severity, we gauge the severity of pancreatitis because it is a very complex disease. And if we see the range of 1 to 100, 70% people having a mild pancreatitis. So mild pancreatitis, moderate pancreatitis and severe pancreatitis. So mild pancreatitis, many times it goes unnoticed. Patient may have a pain in epigastrium, he takes some home remedy and pain will relieve. And he will not come to know that he has pancreatitis. Occasionally, general practitioner gives some analgesic and it will be relieved. So 70% people having a mild pancreatitis, that only the inflammation or सूजन होती है pancreatitis. Moderate pancreatitis is again more complex than the mild pancreatitis. Moderate pancreatitis, there will be a peripancreatic fluid collection. जो pancreas में सूजन होती है उसमें से पानी के आसपास collection होता है. So this is a moderate pancreatitis. And 20% patients having a severe pancreatitis. Severe pancreatitis में what is a severe pancreatitis? The pancreas is become necrose, become gangrenous. Or 10%, 30%, 90% pancreas become totally gangrenous, and this makes life miserable of the patient because this is a dead tissue react differently for each patient. So the mild pancreatitis doesn't require hospitalization, only couple of days medicine. But if there is a gallstone, when this pain relieve, we have to remove the gallbladder. Otherwise, the recurrent pancreatitis again pancreatitis होगा. Moderate pancreatitis, intermediate pancreatitis may require hospitalization because patient is having a pain, vomiting, and he is not taking food. So we admit them, give analgesic, give IV fluid, and then 5 to 6 days they will be discharged. And for prevention, if patient taking alcohol, then we ask them to stop the alcohol, and gallstone is there, then we have to remove the gallstone by doing cholecystectomy. Now the main problem is the severe pancreatitis. If severe pancreatitis with a necrosis or part of the pancreas is damaged, this patient will take long time to recover. Average 1.5 months to 2.5 months. And this patient very serious, in very sick patient having a 90% necrosis, they are having a early organ failure, means their kidney will stop functioning, the patient may need dialysis, respiration is compromised, then we need the ventilator, heart blood pressure is not maintained, we need an inotrope to maintain the blood pressure. So this patient required hospitalization and ICU care. I don't know how long they will take, many times week, 10 days, 15 days, and many patients stay in the ICU for a long period. So severe pancreatitis or necrotizing pancreatitis is a complex disease, very severe disease, and saying that 10 to 15, 5 to 10% patients having a mortality. This patient not going to go home 5 to 10%. So this patient, severe pancreatitis, how this patient die? So in early part, in 1 or 2 days, patients develop organ failure, their kidney stop functioning, blood pressure not maintained, respiration not maintained, and this is called an organ dysfunction and organ failure. And this patient, after support, ventilator support, inotrope support, they may collapse into the ICU. Those patients who came out from this organ dysfunction and their organ slowly recovers, the second hit came, this dead tissue, if it is healed by autolysis, but if it get collected and make a big cyst, big fluid collection, that is called as pseudocyst. Then if it is pseudocyst is there, then we have to operate it, and we make a drain between the do a drain between the stomach and pseudocyst, so it will drain into the stomach. But those necrosis or dead tissue get infected. That is we call it the infected pancreatic necrosis. It is a nightmare for the surgeons to manage. There are so many modalities because this infected necrosis we have to remove emergency. So by doing an open surgery, by doing a laparoscopy surgery, by doing endoscopic procedure, and now retroperitoneal ward procedure, what we do here, most of the cases is retroperitoneal ward procedure. By entering into the retroperitoneum, we remove the old dead tissue and then patient recover. What complication this severe pancreatitis can have? This type of patient, they may have this necrosis spread into the small bowel or large bowel mostly, and large intestine become necrose, perforation. Then we have to do a surgery and remove the large bowel and do an ileostomy. And long term, this patient, because pancreas is damaged, this patient develop diabetes, they develop pancreatic enzyme insufficiency, and they can be managed by taking insulin or taking pancreatic enzyme capsules with their food. And 80% patients recovered without any complications. And for the prevention, if they have any cause for the pancreatitis, we have to cure this cause of hypercalcemia or gallstone, and then they can have no recurrence. So it is a complex disease, very easy to diagnose, but difficult to manage, and having a mortality. If infective necrosis is there, 15 to 20% patients will not go home. They succumb due to the infection. Thank you very much for a kind attention and patience hearing.